Hi guys, I'm Danielle and we're doing another Eon video chat, and today we have Melissa Shields and she's with Skyridge Medical, and I'll let Melissa go ahead and introduce herself.
Hi, my name is Melissa Shields. I am the lung nodule coordinator over at Skyridge Medical Center. I am a nurse by background, but I have been doing lung nodules for probably about a year or so, using EonDirect for about the past couple of months, and I'm very happy with it.
Awesome. That's exactly what we like to hear. No, it's great. And so really we just wanted to discuss with you, Melissa, how Eon has helped your workflow, working specifically with patients and the nodules that have been identified with them. So if you don't mind just talking to us what your workflow was before EonDirect, and now with EonDirect, what that workflow is now that you have our software.
Sure. So before we were working off of an Excel spreadsheet, which has its drawbacks and, its pros to it as well, but mainly more drawbacks than anything. I was not the one that was picking up nodules. Those were being picked up by an outside group, a different team. So they would find the nodules through a different type of language processing software and then send me only certain size nodules. And then those would be entered into a spreadsheet. And then my job was to kind of go through and figure out kind of where they left off and what needed to be done. With the EonDirect and the integration with digital reasoning and patient ID, I have a lot more control over it. And so I kind of know from start to finish what's going on with this nodule and where does it need to go, that kind of thing. One of the things that I like a lot about EonDirect is that it's very user-friendly, and it's easy to kind of navigate from section to section, whereas with the Excel spreadsheet, you were trying to figure out which column am I in and where is this information, am I on the right line, and then God forbid something accidentally gets deleted and you have 15 different people in the same Excel spreadsheet, things can get a little dicey and a little sticky.
Yeah, no, I understand. I remember, just having to use Excel spreadsheets for different projects or whatnot.
Mm-hmm.
And then my friends would teach me different shortcuts and
Yep.
to try and navigate it. And for some reason, it just never got any easier.
Mm-mm.
So I know helping users, like yourself and others transition from the Excel to Eon,
Mm-hmm.
it's like a night and day. I find it's 10 times easier. So I'm glad that you also find it a lot
Yeah,
easier and user-friendly as well.
for sure.
What is kind of your workflow process when a patient is identified in the incoming bucket? Can you walk us through that process as to
Sure.
follow up with them with the appropriate care?
Sure. So it kind of depends on what the size is. Anything less than 8 millimeters, we kind of just follow Fleschner guidelines. We do talk to the primary care doctor and let them know that their patient was seen in our emergency department and that there was this incidental nodule that was found on imaging. And this was kind of the recommendations of what we would recommend for follow-up. And were they comfortable with that? We can help kind of track that, make sure to give them reminders when they're due for their next scan and things like that. Or additionally, if the primary care doctor is not comfortable managing that, we can definitely help facilitate a pulmonary referral and consults to a pulmonologist. If it's anything 8 millimeters or greater, we take it to our multidisciplinary conference that we have twice a month, where a team of our multidisciplinary doctors from radiation oncology, medical oncology, pulmonology, radiologists, pathology, everyone, surgery, everyone kind of looks at it and they say, well, this really should be followed up in 3 months, or this probably needs to be, seen by a pulmonologist, that kind of thing. And then we take those recommendations from conference and take those back to the primary care doctor and say that your patient was discussed. This is what we're recommending. We're happy to help facilitate, anything that you need as far as referrals or follow-up.
No, and that's really awesome because it's really easy to just follow that directly from the very beginning when they were identified,
Mm-hmm.
what we call the incoming bucket, all the way through to follow-ups.
Yep.
And then you can also continue if you want post-diagnosis care or, whatever you find most beneficial in EonDirect. So you know
Mm-hmm.
exactly through using longitudinal, care, what happened to that patient. So it's really great resource in EonDirect to have that and that you're able to go step by step
Mm-hmm.
through that process. So
Absolutely.
that's great that you find that very beneficial. So we're happy for that.
Yeah.
What is one, I know we've touched on a few features, but what is one main feature that you find most beneficial for your workflow?
I would say probably, I don't know, they're all pretty, they're all pretty good. They all help me in different ways. I think that probably my favorite part of it is just the patient details page. It kind of just gives me a snapshot of everything
Right.
from where the patient lives and how old they are and what their demographic information is, what comorbidities do they have, what kind of a cancer history do they have, and that kind of thing. So if I'm talking to a primary care, I can just pull that up real quick and say, oh, well, your patient has these risk factors, and this is why we would recommend that, and that sort of thing.
Yeah, no, that's awesome. Thanks so much for jumping on and joining us today with another Eon chat. And it was really nice talking with you as always. So thank you so much, Melissa.
Perfect. Thanks so much for having me.
Thanks.